Hello and welcome to Peace and Parties channel. Dreger, Fader and Tamar-Mattis on dexamethasone to prevent homosexuality and virilization in CAH women. Dreger, Fader and Tamar-Mattis write in the Journal of Bioethical Inquiry, 30th of July 2012, so just a few days ago, on the use of dexamethasone in pregnant women at risk of carrying a female fetus affected by congenital adrenal hyperplasia (CAH) in the West. To our eyes, this is not just an intersex issue, but an LGBTI issue. It is the physical and behavioral masculinization or virilization of women that is of concern to those proposing dexamethasone use. Further preventing homosexuality and physical masculinization is considered to be of greater benefit than the established cognitive and physical risks to treated children. The authors focus on research on dexamethasone use by Dr. Maria, pediatric endocrinologist at the Mount Sinai School of Medicine in the US, who has received grant support from the US National Institutes of Health. That's all I'm going to say for the moment. I'd like to just make a point, though, that obviously, CAH people, I'd call them people, um, do tend to be more masculinized or masculine in behavior than feminized or feminine in behavior. Generally speaking, that's not speaking for all people with CAH, okay? But it's absolutely wrong for any endocrinologist to presume that because somebody with a vagina is more masculine, that they're going to be gay. Even though a large percentage of CAH vaginate people will be into other vaginate people, but it's not about the hormones and the even the chromosomes for other people, why they're gay. You know, technically speaking, they should be doing surveys. Are all human beings bisexual or trisexual if you consider that there are more than two sexes? I really think that it's important to stop this normalization process by doctors, the medical community, trying to make everybody into perfect Barbie, perfect Ken, trying to make everybody into the same, uh, either being male or female. The fact that so many intersex people exist in the world should be proving that there's such diversity on planet Earth to do with the human species, you know, and I would like to see in the future medical establishment having nearly chains and ropes on them and listening to intersex people before they go and do something like this. And now, thanks for listening. Now I'll continue with what has been written. They This is from OII, by the way. What is CAH and dexamethasone? The authors summarize CAH and treatment with dex as follows. Congenital adrenal hyperplasia (CAH) is a disease of the endocrine system that can cause virilization, i.e. development of masculine traits, in female fetuses. In an attempt to prevent CAH-affected female fetuses from developing in a sexually atypical fashion, some physicians treat pregnant women at risk for having an affected daughter with the steroid dexamethasone. This intervention starts as soon as pregnancy is confirmed and continues throughout the pregnancy if the fetus is ultimately diagnosed as a CAH-affected female. Treatment has become routine in many jurisdictions. This use of DEX was first described in 1984 in the Journal of Pediatrics by Michael David and Maguelone Forest, French clinician researchers. A 2000 to 2001 survey of members of the European Society for Pediatric Endocrinology, representing 125 institutions, found that in 57% of the centers, prenatal diagnosis and treatment of CAH with DEX are routine. Now, rationales for treatment, I say. Rationales for treatment are described as follows from a paper in the 2010 Annals of the New York Academy of Sciences. Without prenatal therapy, masculinization of external genitalia in females is potentially devastating. It carries the risk of wrong sex assignment at birth. difficult reconstructive surgery, and subsequent long-term effects on quality of life. Gender-related behaviours, namely childhood play, peer association, career and leisure time preferences in adolescence and adulthood, maternalism, interest in being a mother, aggression and sexual orientation become masculinized in 46XX girls and women with 21 HOD deficiency. Genital sensitivity impairment and difficulties in sexual function in women who underwent genitoplasty early in life have likewise been reported. We anticipate that prenatal DEX therapy will reduce the well-documented behavioral masculinization and difficulties related to reconstructive surgeries. Dreger, Fader, and Tamar-Mattis note that Dr. Maria New, in a meeting of the CAH Diagnosis Group CARES Foundation, displayed a photo of a girl with ambiguous genitalia and said, "The challenge here is to see what could be done to restore this baby to the normal female appearance, which would be compatible with her parents presenting her as a girl, with her eventually becoming somebody's wife and having normal sexual development and becoming a mother, and she has all the machinery for motherhood, and therefore nothing should stop that. If we can repair her surgically and help her psychologically to continue to grow and develop as a girl." Other notable medical practitioners are also involved in the research, and these justifications. Heino Meyer-Ballberg of Columbia University is a member of the American Psychiatric Association Working Group on revisions to the Pathologizing Diagnostic and Statistical Manual on Mental Disorders, and a member of the Standards of Care Revision Committee of the World Professional Association for Transgender Health. In his 1999 paper, "What Causes Low Rates of Childbearing in Congenital Adrenal Hyperplasia," Meyer-Ballberg noted, CAH women as a group have a lower interest than controls in getting married and performing the traditional child care housewife role. As children, they show an unusually low interest in engaging in maternal play with baby dolls, and their interest in caring for infants. The frequency of daydreams or fantasies of pregnancy and motherhood, or the expressed wish of experiencing pregnancy and having children on their own, appear to be relatively low in all age groups. Now, the risk of treatment for the DEX. The authors discuss the outcomes of research in Sweden, which has led to the discontinuation of DEX use there, cognitive and behavioral issues in CAH, unaffected kids, and less masculinity in treated boys. When compared to controls, in general, treated children were born at term and were not small for gestational age. As a group, they did not exhibit teratogenous effect, no idea how to say that, gross malformations, although 8 severe adverse events were noted in the treated group compared with 1 in the control group. 3 children failed to thrive during the first year of life. In addition, 1 had developmental delay and hypospadias, 1 had hydrocephalus, 2 girls were born small for gestational age, and 1 of these girls was later diagnosed with mental retardation, and 1 child had severe mood fluctuations that caused hospital admission. In the control group, only 1 child was admitted because of Down syndrome. Adverse effect was observed in the form of impaired verbal working memory in CAH, unaffected short-term treated cases, i.e. the children who are not the intended targets of the intervention. The verbal working memory capacity correlated with the children's self-perception of difficulties in scholastic ability, another measure showing significantly lower results in CAH unaffected DEX-exposed children. These children also reported increased social anxiety. In the studies on gender role behavior, we found indications of more neutral behaviors in DEX-exposed boys. Despite these published reported risks, DEX treatment is being sold to parents of Dr. Maria New in the US as safe and effective. So, I won't go on with the last paragraph. The bottom line is that DEX seems to be a very terrible drug that seems safe and is, they say, adequate and fine to be treating anybody on it. This is all to do with normalization of human beings, so that the medical establishment don't ever have to deal with intersex people getting confident that we're normal, which we are. They're basically saying that we're abnormal and we need to be fixed and treated. And I disagree with that. Peace and Party disagrees with the fact that it's just males and females in the world. Peace and Party believes that there's more than males and females in the world, or there's just one sex, and that's human. So let's work together, people, in stopping this normalization and these unnecessary corrective surgeries and corrective drugs for trying to stop homosexuality, which is a joke, because actually technically we could nearly all be bisexual if we didn't think in our minds of two sexes. Ciao, people. Enjoy your day.